Now, in the meantime, you mentioned the facility and the care that's needed at home. How do you, the team members, craft that plan? So, as you said, there are different manifestations of COVID-19. Some people have the vascular issues, some have more pulmonary, some have pulmonary plus cardiac, some have, like you said, that Guillain-Barré type syndrome where every system was impacted, particularly neurological, so they're not even maybe mobile. How do you determine what you're going to do for them at home, Dr. Monique? 1 second, I have to unmute you. There we go.
Well, when you go in for the initial visit, you do a complete assessment and you ask the patient and the caregivers what their goals are. And you work from there, you develop a plan of care for that patient to meet those specific goals. So depending on how they present, you determine if you're going to be working on balance, walking, pulmonary PT. But most of the patients and the family members just want them sitting up, which they're having problems doing, and just moving around. The longer they stay laying down, the weaker they are going to become, and also have a risk of developing pneumonia again, just laying in the bed. So it's a catch-22 situation because they're mentally drained, they're weak, and
you need to get them up.
We need to get them up. So we don't have a choice. And prior to, in terms of the policies, in January, CMS had cut rehab visits and reimbursement.
Medicaid services, right? And Medicare?
Yes, they did. So a lot of agencies were actually reducing physical therapy visits. So for this to happen right after that happened, it's crazy.
Wow.
Caregivers are demanding more visits and frequency of visits, but the agencies can't provide it.
Right, because they're limited by Medicare.
Yeah.
Right. And these patients you're seeing, are they primarily elderly or previously infirmed patients?
Actually, we're seeing a wide range of patients. We're seeing people in their 40s, 50s, 60s. The oldest COVID patient that I have is 82.
But they're people young, in their 40s, etc., coming home with weakness and needing different types of long-term care just to rehabilitate.
Yeah.